Hi, welcome back to the series Expert in 6 Minutes, where I will try to make any medical topic simple and easily understandable for you within 6 minutes. Before watching this video, I suggest you to watch these two videos for better clarity. But if you do know the basics of the external ear and the middle ear cleft, then this video is more than enough for you. Most of you would have seen a cube-shaped structure or diagram of the middle ear in your textbooks, but in real life it is an hourglass shaped structure. For easy understanding, it is best described as a cube. Before jumping into this cube thing, you have to know that the middle ear is divided into 4 parts. They are epitympanum, mesotympanum, hypotympanum and protympanum. The part that lies against the pars flaccida is called as the epitympanum, and the part that lies against the pars tensa is called mesotympanum, and the part that lies below the level of annulus is called hypotympanum, and the part that lies against the eustachian tube is called as the protympanum. So let's imagine the middle ear as a room, and the door is the tympanic membrane, which lies on the lateral aspect. Like any other typical room, this one also has 4 walls and 1 roof and 1 floor. Now our job is very simple. We just have to learn about this room. Let's start with the easiest one. We discussed a while ago that the lateral aspect is formed by the tympanic membrane. Thereby, obviously, the lateral wall is made up of the tympanic membrane, and it is also formed by the outer wall of the attic, and it has a special name for it called scutum. Now that the lateral wall, or in our language the door, is finished, we'll move on to the next side by entering into the room. To give you a little context, we remove the lateral wall. Therefore, this must be the medial wall, and this is obviously the roof and the floor. This is the anterior wall, and this is the posterior wall. The anterior wall is towards the eustachian tube, and the posterior wall is towards the mastoid. Beginning with the posterior wall, it has only 2 structures, a projection and an opening. The projection is called as the pyramid, and the opening is called as the adytus. Let's finish the roof and the floor. The roof is made up of tegmen tympani. It is a thin bone. It separates the middle ear from the middle cranial fossa, and the floor is also a thin bone separating the middle ear from the internal jugular vein. Out of the 6 sides of the cube, we just finished 4 sides. Now to the 5th wall, it is very simple. Most of you will know that the eustachian tube opening is in the anterior wall, and above that a muscle called tensor tympani is present. Don't confuse it with the tegmen tympani bone present in the roof. Back to the anterior wall, it is also related to one more structure, the internal carotid artery. I have a little trick to remember this since it is very confusing. The anterior wall, it has an artery, A for A, and the posterior wall, it has a projection called pyramid, P for P. So we just finished 5 out of 6 sides. So quickly going over them once again. The lateral wall is made up of the tympanic membrane and the outer wall of the attic, also known as scutum. The roof is made up of a thin plate of bone called tegmen tympani, separating the middle ear from the middle cranial fossa, and the floor is also a thin plate bone related to the internal jugular vein. And the posterior wall has a projection called pyramid and an opening called adytus. And the anterior wall has 3 structures, tensor tympani muscle, eustachian tube opening, and it is also related to the internal carotid artery. Now only one is remaining. It's rather tough, so I kept it to the last. But don't worry, I have an easy trick in my bag for this one too. This medial wall separates the middle ear from the inner ear. So whatever the contents of the inner ear are, it should form an impression in the medial wall, right? Yeah, common sense. The contents of the inner ear are the semicircular canal, vestibule, and the cochlea. Now the trick we were talking about is, remember this one line: 2 impressions, 2 window, 1 nerve, and 1 projection. The 2 impressions that we are talking about are the impressions of the cochlea and the impression of the semicircular canal. The impression of the cochlea is called as the promontory. The two impressions are over. Then the two windows. Those are the round and the oval window. The one nerve is your facial nerve and the one projection is your cochleariformis processes. That's it about the walls of the medial ear. I really do hope the walls and its relations are clear to you. Thank you.